It's estimated that 6 out of every 100 men experience low testosterone levels, a condition frequently disregarded. Testosterone plays a crucial role in managing various bodily functions, and neglecting its low levels can have adverse effects on both your health and lifestyle. Recognizing the symptoms of low testosterone promptly and seeking appropriate help is crucial. That's why we're diving into understanding these signs and exploring effective ways to address them. And don't miss out on number 9, because nearly 90% of men worldwide deal with this problem. So let's get started. 1. Loss of libido. Testosterone is the key hormone in today's topic, which is mainly made in the testicles, and it's a big deal for your sexual function. It helps build muscles, keeps your bones strong, and gets sperm production going. During puberty, it's essential for the development of lean muscle. Interestingly, your sex drive is also linked to your testosterone levels. While normal levels vary, the American Urological Association considers levels below 300 nanograms per deciliter as low testosterone, which can significantly impact your sex drive. Reduced sexual desire often accompanies declining testosterone levels, with age being a contributing factor. While various factors can affect libido, low testosterone, also known as hypogonadism, is frequently implicated. So if you're experiencing a dip in sexual drive, it's worth checking your testosterone levels to address any potential issues and maintain overall health and well-being. 2. Poor sleep quality. When your testosterone levels drop, it can mess up your sleep. Low testosterone can lead to problems like insomnia and changes in your sleep patterns. And in fact, researchers found that as testosterone decreases, the stress hormone cortisol goes up. And as one problem leads to another, cortisol makes you more alert, which means your sleep cycles might get shorter and not as deep. Also, testosterone replacement therapy could make sleep apnea worse or even cause it in the first place. It's a serious condition that can constantly affect your sleep and raise your chances of having a stroke. Even if you don't have sleep apnea, low testosterone can still mean you get fewer hours of sleep. So if you're having trouble sleeping and think it might be linked to low testosterone, it's important to talk to your doctor. 3. Unexplained fatigue. Feeling like you're dragging yourself through each day? Well, there may be more to it than just a busy schedule. It could be a testosterone nosedive, especially for guys. Testosterone is your body's natural energy booster, pumping you up with vitality and driving you to hit the gym. But when it's in short supply, it's like your muscles are on strike and your body's storing more fat than it should, leaving you feeling depleted. In fact, low testosterone can throw your mood into a tailspin, making everything seem a shade darker and leaving you feeling like you're stuck in a rut. So, if you're nodding along, it's high time to have a heart-to-heart with your doctor about getting those testosterone levels back on track. 4. Sudden weight gain. Testosterone isn't just about muscles and libido. It also influences your metabolism. When testosterone levels drop below normal, it can kickstart a troublesome cycle. Your metabolism slows, messing with your body's ability to regulate blood sugar, produce insulin, and control lipid buildup in your cardiovascular system. This leads to more body fat and weight gain. Interestingly, in obese individuals, fat cells release substances that hamper testosterone production, potentially creating a loop of obesity and hypogonadism. So whether you're dealing with obesity or low testosterone, there's a connection between the two, showing how important it is to keep testosterone levels in balance for overall metabolic well-being. By the way, if you think this video gave you any value, don't forget to subscribe to our channel and get ready for more exciting content coming your way. 5. Gynecomastia. When testosterone levels drop below normal in men, it can lead to some unexpected changes, like developing more female-like features. One common change is called gynecomastia, where the breasts become larger. Research shows that 1 in 4 men aged 50 and older may experience this due to low testosterone levels. When testosterone is low, estrogen starts to have more influence on the male body, leading to features like gynecomastia. Although gynecomastia is usually harmless, it's a sign of hypergonadism, which isn't pleasant news. So if you notice any changes like this, you must act immediately. Feel free to drop a comment below if you've ever taken a testosterone test, and share which one you think is the most effective. 6. Erectile dysfunction. Having trouble getting it up? This is definitely one of the most common signs of low testosterone, especially if you're not feeling as frisky as usual. Researchers say about 1 in 3 guys with erectile dysfunction might also have low testosterone. While low testosterone doesn't directly cause ED for everyone, it can play a part in a few ways. First off, low testosterone can dampen your sex drive, making those sexy thoughts less frequent. Plus, it can put a damper on your mood, increasing stress levels, which can mess with your ability to perform. Feeling tired all the time from low testosterone might also make you less interested in getting busy. What's more, low testosterone often leads to weight gain and less physical activity, which can increase your risk for diabetes, high cholesterol, high blood pressure, and heart disease, all of which can make ED more likely. So if you're having bedroom troubles, low testosterone could be a factor worth considering. 7. Depression. While researchers aren't exactly sure how low testosterone leads to depression, it could be related to how testosterone helps you feel good. Testosterone boosts the release of dopamine, a brain chemical that makes you feel pleasure. There's also a link between testosterone levels and serotonin, another brain chemical tied to mood. Low serotonin activity is linked to depression, and testosterone might help improve serotonin function in the brain, lifting your mood. Some researchers even think testosterone has anti-anxiety effects, helping to keep you calm when stress hits. 8. Osteoporosis. There's a common belief that only women get osteoporosis, but that's not entirely true. While women are more likely to develop it, men can also be affected. Low testosterone levels can weaken men's bones. In fact, a 2013 study found that about 35% of men under 50 attending infertility clinics had low bone density, which can lead to osteopenia or borderline osteoporosis, especially in the hip and spine. Testosterone plays a vital role in bone health for men. It works directly on bone-forming cells called osteoblasts, helping to build strong bones. Additionally, testosterone prevents bone resorption, which is the process of breaking down bones. When testosterone levels drop, bone resorption speeds up while bone formation slows down, leading to weaker bones. So it's crucial for men to pay attention to their bone health and consider getting their testosterone levels checked, especially if they're experiencing symptoms like bone pain or fractures. 9. Cognitive decline. As you age, both testosterone levels and cognitive functions tend to decline. Doctors think low testosterone levels might have something to do with it. In fact, a 2019 review found that testosterone supplements might help improve memory in older men with low testosterone, although the improvement may be small. Of course, if you're worried about your testosterone levels, talking to a doctor is a smart move. They can check your levels and create a treatment plan if needed. Some people also try herbal supplements known as testosterone boosters, but one common and trusted therapy is testosterone replacement therapy. TRT is used by millions of men to boost low testosterone levels and improve alertness, energy, mental sharpness, and sexual function. If you and your doctor decide that TRT is the way to go, there are different methods available, like gels, skin patches, injections, or oral therapy. Each method has its pros and cons, so it's important to discuss them with your doctor to find the best option for you. But if you want some natural solutions, we have a video just for you to try a few natural ways to boost your testosterone levels fast.